My name is Leslie London, and I'm a professor in the School of Public Health and Family Medicine at the University of Cape Town, part of a collaborative team based at UCT, Stellenbosch, Great Lakes University, Cameroon Bioethics Initiative, and the American University of Beirut. And I'm welcoming you to this collaborative presentation around conflict of interest in health research as part of a project to strengthen capacity in ethics committees in sub-Saharan Africa and science councils. Why are we focusing on conflict of interest? It's because health research is key for improving health and preventing disease. We've seen during COVID, for instance, how conflict of interest can negatively impact the integrity of research, undermine the quality of evidence, and result in flawed policy and practice. The chloroquine example was one of a number where results were misrepresented and led to quite significant impacts on how to control the disease. So we need to manage conflict of interest and build the capacity to do so and ensure that our research is free of vested interests. So this project really arises from a collaborative study with the American University of Beirut, which looked into the attitudes into accepting funding from corporates for non-communicable disease research. The corporates clearly have an important role on health policy. They've tried to influence health policy in different ways, to the extent that the WHO has developed guidance on managing conflict of interest in nutrition policy. And the AUB-led study looked at what schools of public health do when faced with the offers of funding. And what that study found was that, in fact, across 5 regions and globally, more than 50% of respondents indicated they would accept funding, 20% had actually accepted funding, and more than 60% though recognized there was a risk of bias in research. So it pointed to the need for more dialogue, and the project then set up a network on global conflict of interest, how to manage it. But this project really is an offshoot of that, and it's supported by the International Development Research Center in Canada, and it's focused on science granting councils and health research ethics committees. And it comprises 3 parts: a baseline needs and capacity assessment, developing of an online open access course, and developing of a toolkit to strengthen the capacity of science councils and health research ethics committees. As I said, the team is drawn from 5 institutions: myself, Professor Mark Blockman, Dr. Amina Saban at UCT, Professor Kimentri Mudli, head of the Center for Medical Ethics and Law at Stellenbosch, Professor Stephen Okayo at Great Lakes University in Kisumu, Professor Godfrey Tangwa, and a postdoc, Dr. Munung, who are from the Cameroonian Bioethics Initiative, and Professor Judy Makul from the American University of Beirut in Lebanon. So today we are going to discuss conflict of interest. We have an excellent panel. We're going to share some thoughts, and I'm very appreciative to all of them for making themselves available. We're going to spend about an hour, hour and a half, depending, with the presentations and discussion. And then we'll finish off just outlining the project to build capacity for managing conflict of interest and take any questions that anyone has. We are recording this webinar, and we will pause after the panel discussion for questions and discussion. And after each speaker, if there are questions for clarity, we'll also take that. And at the final input, we'll also set aside time for any questions and discussion. So that is the outline. Unfortunately, Dr. Macabalo is unable to join us personally, but she has sent a recorded message, which I will play shortly. If I could just ask the participants to mute their microphones for the duration, use the function of raising hands or post information in the chat. Dr. Saban will scan the chat and alert the chair to any points raised. So without further ado, I'm going to unshare my screen and then share Dr. Macabalo's opening comments from the WHO. Dr. Macabalo is a deputy director with the Afro region and has worked extensively in Southern Africa and Africa as a public health advocate. She's worked on scientific and advisory boards, worked on the South African Medicines Control Council. She was involved with National Ethics Councils and with the WHO Strategic Advisory Group on Malaria Eradication, as well as the African representative UNITAID. She's had a diplomatic role and she's currently the Assistant Regional Director at WHO Afro. And I will in a moment share her message. Can I confirm that you can see her screen?
Yes.
Okay, so over to you, Dr. Macabalo.
Good afternoon, and my thanks to Professor London and the School of Public Health for the invitation to participate in today's webinar to discuss conflict of interest in research and launch this important project. WHO is pleased to have been invited to be part of this important initiative. At WHO Afro, this work led by the University of Cape Town is seen in a very good light. It is arriving at a very opportune time. Never before has there been such widespread acknowledgement and interest actually in research and research findings to guide and inform public health policy, as we have seen during this COVID-19 pandemic period. Also, at the regional office, we have recently established a new division to address science, evidence, and research, which I am leading. We're expanding our work to strengthen health research and research governance on the continent. One of the areas that our research governance areas will include is that of research ethics. Some of the critical areas of interest will also include strengthening governance tools, supporting the establishment and strengthening of ethics committees, training and capacity building, so on. In addition to working closely with countries, we see the most effective way to proceed as being one of working in close relationship with science councils and science institutes, working with university departments and other health partners in the region. As well as, of course, working closely with our advisory committee for health, research and development, which has representation from a large number of research experts from across the continent. So we are quite excited to be working to collaborate in these areas, and we see this work as being a very exciting piece of work. When not appropriately addressed, research results in inbuilt biases, policies and practices that can negatively impact public health and produce poor health outcomes. At all costs, we need to address these concerns. WHO has taken some measures in recent years to guard against conflict of interest in its relationships with partnering bodies. As a result, the framework of engagement with non-state actors, known as FENSA, was negotiated by member states in 2016. And member state agreed that this was required to provide a system of guidance to monitor and prevent conflict of interest. Of course, other internal measures such as our research committees and vetting for conflict of interest have been long-standing practices. In many technical areas, research has been critical to determine whether some products or interventions would or would not be harmful. Research in areas such as sugar-sweetened beverages, the use of various forms of tobacco products, etc., have triggered much debate on research methods used and ways in which conflict of interest was addressed in those studies. There have been calls following many of areas of debate and concern that there should be more research on how to conduct work in a way that conflict of interest can be avoided, prevented, monitored, and so on. One example of ongoing work at WHO has been led by our WHO Nutrition Department on preventing and managing conflict of interest in nutrition policies and programs. This was based on a resolution which was concluded by member states. One of their findings and one of the areas that they highlighted is the importance of a deeper engagement by academia and research institutes, because the onus is really on governments to take policy decisions, but these policy decisions have to be informed and informed by research and evidence. The program launched the conflict of interest, the program being launched today on conflict of interest in health research, which is including building of capacity of science councils and health research ethics, is really good news for us and very welcome. And in many ways, a first to develop a larger, sort of more systematic way to address risks and conflict of interest in research. So we're really excited about it. WHO Afro is keen to work closely with the University of Cape Town and the other partners in the sub-region, sub-Saharan African region, as you continue to develop this work. And on behalf of the regional office, the regional director, and my colleagues, I extend my best wishes for the webinar. Thanks to my colleagues who will be joining the webinar today. We look forward to the follow-up work and look forward also to partnering with this program. Thank you very much and have a good day.
So thank you very much, Dr. Macabalo. Thank you for opening the webinar and for your comments. I'm going to then hand over to Samuel Oti, who's the IDRC representative in Nairobi, who helped us think through this project, just for some opening comments before I hand over to some of the other speakers. Over to you, Samuel.
Thank you, Leslie. Can you hear me?
Yes, we can hear you very clearly.
Great. Hello, everyone, and hope you're each keeping safe and well. As Leslie said, my name is Sam Oti. I am a senior program specialist with the Global Health Division of Canada's International Development Research Center. I sit in our regional office for Eastern and Southern Africa here in Nairobi. And as you might know, IDRC is a Canadian Crown Corporation, and we have been supporting research for development in low and middle income countries for the past 50 years. I'm honored to be participating in this webinar and would like to say thank you to Leslie and his team at UCT for organizing it. And I'd like to acknowledge the presence of the distinguished panelists. I see Dr. Ahmed Agboola, who I know quite well. Thank you for making the time and effort. And to all of you joining us online, bienvenue, karibu sana, you're very welcome. Very briefly, there's a blog entitled Food Politics that I follow personally. And it's written by Prof. Marian Nessel. She's a distinguished professor of nutrition at New York University. She's quite vocal about conflict of interest in nutrition science and public health. And she has always argued that industry sponsorship of nutrition research is not about science. It's all about marketing. And in fact, in her blog, she has a special section entitled Industry Sponsored Study of the Week, where she analyzes the findings of peer-reviewed publications that are sponsored directly or indirectly by industry. And not surprisingly, in most of the papers that she analyzed, the results are favorable to the economic interests of the sponsoring industry. That is not to say that all industry-sponsored research has issues or question marks. Of course not. But nevertheless, as you've heard from Leslie and Dr. Macabalo, there is a real concern, especially in the field of public health and nutrition, that economic interests tend to outweigh scientific ones when it comes to some industry-sponsored research. And this is what is called the funding effect. It's not a new phenomenon. And in fact, it's probably the main reason why scientific journals demand that authors declare conflicts of interest when submitting an article for peer review. But declaration is not enough. Most forms of conflict of interest in research are covert rather than overt. And that's why the research project that you hear about later on is, and which Leslie introduced, is seeking to enhance the abilities of what I believe are the gatekeepers of the research ecosystem, such as science granting councils, ethics review committees, institutional review boards, to be able to better detect, prevent, and eliminate conflicts of interest in public health research studies that come their way. I have a whole lot to say about this issue, but I don't want to preempt the conversations that you're here today. So let me stop there. And once again, thank you all for joining us. And I'm really looking forward to the panel discussion and presentation. Back to you, Leslie.
Okay, thanks so much, Samuel. So I'm very pleased to introduce to the meeting Dr. Ahmed Agboola, who is the Deputy Director for the Africa CDC. We are very honored to have you participate, and so pleased you've been able to join us. Just by way of background, Dr. Agboola has a background in public health, in resource mobilization, health security, health emergencies, prevention and control of NCDs, building multi-sectoral partnerships, intersectoral cooperation across sectors, tobacco control, a very broad spectrum of skills. And we are really looking forward to hearing your comments about this topic, because I think between WHO Afro and Africa CDC, these are the two main regional agencies that are going to make use of the kinds of products of research. So over to you, Dr. Agboola. I don't know if you need to screen share, and if Simpiwe can assist you in that regard.
Thanks a lot, Leslie, and good morning, good afternoon, good evening, colleagues, wherever you are. A pleasure to be here. And yes, if I can share my screen, that would be good, so that I can just go through some thoughts around this conflict of interest issue as I share concurrently our thinking here in Africa CDC. So let me just share my screen.
Dr. Agboola, it should be enabled. I'm just checking that it is working.
Yes.
It is enabled. Yeah.
Yes, it is. Let me just, okay. That's, here we are. Very well. I just want to go through some ideas along the line of the topic of today. And first, let me say that I'm really honored to have been invited to share the next so long with this particular group, talking a bit about a very important topic in conflict of interest, particularly in health research. I'll divide my presentation into those three areas. So by way of introduction, it is important just to step back a bit and look at what health research is all about. And also to agree that it is really a continuum and not just steps. It is a continuum where one fits very smoothly into the other. And it involves different approaches, whether it is primary data that one is generating, whether it is secondary data that one is generating, and the different methodology of trying to reach that data as has been listed there. So the whole continuum is really designed to ensure that we are creating knowledge, or we are critiquing knowledge, or we are actually addressing a specific problem that is there within the community. And when we have generated that kind of knowledge, then we disseminate it as effectively as possible. So it is a very essential part of growth, not only in knowledge, but also in intervention, particularly in the area of health, because there are always new things and newer ways of getting some of these solutions to support and help public health intervention on the continent. Now, there are several, if you want, traits in as far as building trust is concerned, because research is all about trust. If you do not have trust, then you are not able to form a good team. You're not able to engage with the communities, the policymakers who will consume the results of the research, indeed members of the public who will be the beneficiaries eventually. That trust needs to be built. And as part of building the trust, it is extremely important that we approach, tackle, engage with all the relevant actors and stakeholders in research. Now, the traits that have been given there are, I'm sure, very well known to all of us who are within the research environment. But the key part of this is that we not only build trust, but as part of building trust, we ensure that we are respecting the rights of those who are going to be the subject of our research. We ensure that we respect the rights of colleagues and stakeholders that we work with in this area. And we also ensure that whichever research methodology that we are using conforms to the laws in any particular country where we are going to conduct this research. So when we are building trust, we need to ensure that we know who our stakeholders are. And these stakeholders, as we define them, we need to ensure that we are approaching them based on their interest in that particular research matter. Broadly, you can look at them in terms of those who are going to provide the resources for the research to actually take place, those who are actually going to implement the research itself, whether it is researchers in the back office or research assistants out in the field. And then, of course, they are the participants who are going to be the ones who provide you with the information that you need, and eventually those who are going to consume the research in terms of policymakers. So when we have clarity of who our stakeholders are, then we are able to address all issues around conflict of interest even more efficiently. Now, when we look at conflict of interest, and I think we have already seen from the previous slides that the engagement is very broad. There are a number of constituencies that we need to engage and satisfy their interests. We need to be also clearly define what a conflict of interest means. And we don't want a situation where these financial or personal considerations actually end up compromising our research. So when we tackle the conflict of interest from the level when it is still a potential, it is much better than when we wait until it is an actual conflict of interest. And this is because, and I think Leslie already pointed to some of these aspects, we don't want to harm research itself in terms of an area, an enterprise, because if we harm research, it means that we will not be trusting in what comes out of research activities. We will not be able to utilize that information with members of the public. And for sure, if we do not address conflict of interest, then we put in harm's way all those that are going to form part of our study group, as it were. So all those participants in any study are definitely going to be affected. So we need to tackle this way before it actually becomes an actual conflict of interest. And this research that is going to be conducted by this consortium led by Leslie's team is extremely timely and very important. And at Africa CDC, we support every action that is going to ensure that the data that we generate on this continent and everywhere else is credible and can be able to be used to drive our policy. So this is just the types of conflict of interest that we face, whether it is intangible or whether it is tangible. I think the message here is that whichever situation that we are in, however we approach the issue of conflict of interest, we must ensure that we address it early. We must ensure that we have the capacity and capability, and we have the systems that can be able to address these conflicts of interest. But when we've identified, then what do we do? And this is something that we grapple with at Africa CDC on a very regular basis, because our work, our systems are designed to use evidence. And we want to be sure that every time that we are giving evidence, we are sure that that evidence has been generated in the best possible way, including accommodating conflicts of interest. So mitigating conflict of interest is extremely, extremely important. We can do it at several levels. And the first that I would like to speak about is the institutional level. And I think this is what part of the research is going to tackle. And there is need to be able to develop this in Africa particularly, because we are catching up in as far as research is concerned, and therefore the systems required, including conflict of interest agencies that address conflicts of interest, need to, that capacity and capability needs to be built on the continent. At the individual level, we really need to build the integrity of our researchers. And this needs to start from when they are young professionals, all the way to when they become the ones who are guiding a larger groups. And then if we address the issues of integrity, then all the others will be able to follow: objectivity, accuracy, efficiency, trustfulness. All these will follow. That integrity of a researcher needs to be built early, and I hope that this research will be able to capture some of these things. So in ending, I would just like to leave you with 4 takeaways. One is that conflict of interest is really part and parcel of the whole research enterprise. If we don't address it, then the whole area of research collapses, and this will have extremely big consequences to all aspects of our life, particularly in the health sector. Second is that building trust within the team, within the institution, is an extremely, extremely important step to ensure that our research remains objective, and that every information that is coming out of that research is targeted at very specific areas that will result in not just better knowledge, but improved ways of us tackling a particular problem. Third is that conflict of interest has big consequences, and those consequences can actually be able to provide a fertile ground for those who want to challenge some aspects of our knowledge or interventions is concerned. So the consequences of conflict of interest actually are increased risk of the purpose itself of research. And finally, is that institutions need to place adequate checks and balances to be able to detect and mitigate conflict of interest way in advance before it becomes an actual problem. And I hope that the research results from this particular research we are going to discuss today will be able to address this. Finally, is to say that Africa CDC remains available to be part and parcel of ensuring that conflict of interest is effectively addressed, because we are consumers of good knowledge, and we want to be sure that what we are consuming as a result of research have been appropriately protected from any conflicts of interest. I thank you.
Thank you so much, Dr. Agboola. That was very clear, and it was really a strong message around the importance of systems, and I really appreciate that. We thought we would just pause if there's any questions of clarity from the audience. If anyone has any questions of clarity they wish to raise. I'm not seeing any. So it was obviously a very clear presentation and very to the point. So thank you. I'm going to now invite Professor Pauline Ndebele, who is a senior research regulatory specialist at the Office of Research Excellence in George Washington University School of Public Health. He's also a lecturer in the Department of Global Health. He has a PhD in research ethics from the University of KwaZulu-Natal, and he has a big interest and focus on improving the practice of research, informed consent, ethics review capacity, public health ethics, and justice in general. He's also gotten up very early in the morning in the US to be part of this, and we greatly appreciate his willingness to do that. So I'm going to hand over to Professor Ndebele to share with us his presentation.
Thanks, Leslie. Can you see my slides?
Yes, they're very clear.
Oh, wonderful. Thank you very much for inviting me to be part of this very, very interesting and important conversation for Sub-Saharan Africa. So when I was invited to be part of this gathering, for me, I thought that the important thing would be for me to share my experiences here. So basically within my office, I'm mainly responsible for coordinating issues around conflicts of interest and also any other issues around the ethics of research within my university. So I titled my presentation Structures and Procedures for Handling Conflicts of Interest and Conflicts of Commitment Issues in Research. And I thought, yes, there are a few lessons that science granting councils can learn from a university setting. So basically, I'm going to share our experience in that regard. So I'm going to touch briefly on our policies as a university and also our structures for handling conflicts of interest. And then more importantly, I'm going to highlight how we are complying with government and also funder expectations, because here the important thing is for the science granting councils to glean a few lessons in terms of how we jump when we are ordered by the funders to jump. And then I'm also going to touch on a few challenges that we face within our own university in addressing conflicts of interest issues. And then more importantly, touch on the various strategies that we commonly use in managing conflicts of interest, and then throw in a few concluding remarks. So within our university, we've got two conflicts of interest policies. One is for the academics, and then the other one is for other staff. So if you look at, I've actually listed there the number of pages in each. You see that the one for academics is much longer compared to the one for other staff. That one is 32 pages and the other one is only 17 pages, and you soon note why. So our policies articulate our key institutional values. They articulate our key principles. They also define potential conflicts and also conflicts of commitment. But more importantly, they describe the disclosure requirements and also assign accountability for implementing and monitoring conflict of interest issues. Our policy is actually based on federal regulations and funder policies. So we are mainly looking at the policies from the public health services, because our main funder is actually the NIH. And we also have policies coming from the FDA, which is the Food and Drugs Administration, and also the National Science Foundation. So what I'm trying to show here is whenever there are any new requirements coming from these big funders and regulators, we simply have to implement as grantees, right? Because these are the big guys who are funding all the research that is being conducted within our institution. If they ask us to cough, we'll actually ask, how loud should we be coughing? That shows the power of the research funders. I just want to highlight a few of the requirements that have been placed on us by the funders. They require disclosure of financial interests of faculty and also immediate family members. that is by the investigators. And they've actually set a target of 10,000, but for us as an institution, we've actually reduced this to $5,000. They also require that we be very, very clear as institutions on who reviews the disclosures and also the criteria for review. The funders also require that we actually come up with ways in which to manage significant financial conflicts of interest. But they also require that we as institution, provide certain certifications at different points when our investigators are submitting their proposals to the funders and during the time that they are spending the funds that are coming from the funders. They also require that we keep those records for 3 years after the final expenditure report. And what this also means is if they request for any records, we actually provide those records. They also require that we as institutions, we must inform our investigators of these federal regulations. They also require that we as institutions must inform our investigators about our own institutional policies, and also that we must inform the investigators about their responsibilities regarding disclosure of significant financial interests. They also require that before each funder can spend any funds, they should actually go through some training. They also require that this training be provided every 4 years. And also that whenever we change our policies, we need to go back to our investigators and inform them about the new changes. Whenever someone new joins our institution, we also need to provide training to them about conflicts of interest. So we've got various tools that we use in terms of handling conflicts of interest. We have the periodic faculty member and investigator financial disclosure form, and this one is completed once every year. And then whenever someone is submitting a proposal through our institution, they actually need to complete a conflict of interest disclosure form in which they are stating whether there are any conflicts related to this particular proposal that they are providing right now. But more importantly, we also have an online intake form for anonymous reporting of conflicts of interest. So this actually means that as I am implementing my own research, there are others who are watching, and if they feel that there's something that is wrong, they can actually report anonymously through that particular online intake form. So this just shows how serious we are when it comes to conflicts of interest issues. And regarding the structures and responsibilities, the main entity is the Office of the Provost, which has overall responsibility over faculty affairs. And then we've got the Office of the Vice President for Research, who provides research oversight. And this is the office which is also responsible for reporting to the funders. But under this office, there is the Office of Research Integrity. So I work directly under the Office of Research Integrity, and I'm based within the lower office, which is based in the Dean's office. So basically, through our office, we actually do the review of the disclosures. We also approve the conflict of interest management plans. We also supervise the implementation of those plans, and we also convene the school's conflicts consultation committees. The heads of department are responsible for direct supervision of the investigators who are conflicted. And then the investigators themselves are responsible for disclosing conflicts of interest, and then they work with us in drafting conflicts of interest management plans, and then in implementing those plans, and also in reporting on those plans every year. With regards to the university expectations on conflicts of interest, they are the annual declarations. So every year at a particular point in time, everyone is expected to declare their conflicts. But of course, every investigator is also expected to disclose conflicts when they are submitting every proposal, and then annually at continuing review. And then whenever someone has acquired a new interest, they are supposed to report that particular new interest within 30 days of discovering or acquiring that new interest. And then, of course, whenever there are conflicts that have been identified, we can actually come up with the management plan. And then, of course, we require supervision and annual reporting on those management plans. So with regards to the various strategies that we use for managing potential conflicts of interest, at times we require disclosure. So it might be disclosure to the institution or the institutional review board or the research ethics committee, but we might also require disclosure to the research volunteers or the patients if it is a situation where the clinician is working with their patients. But we might also require disclosure in journals and also during conferences. We might also require some management strategies, which might include monitoring of the research by a DSMB or some independent other entities, or we might actually require modification of the research plan. In so many cases, when we feel that the investigator is conflicted, we might actually require that they add in a third party who is not conflicted so that they are working together on all important points. We might also come up with various prohibitions. For example, we might actually remove the researcher from a particular study, or we might exclude the researcher from decision-making, or request that they cut off the relationship with that particular entity that brings about that conflict. But more importantly, for potential conflicts, we might also provide counseling letters to the investigators, where we are saying, please take all necessary precautions to ensure that this interest that you have disclosed does not introduce bias into your research or into your work. In terms of the conflict of interest management plans, it includes a full description of the external relationships and also identification of the areas of potential conflicts of interest, and then of course the management strategies to guard against the escalation of a conflict of interest. So once we have drafted this with the investigators, it then goes up to the chair of department, to the dean, and then of course to up to the office of the provost for final approval. Once it has been signed by the provost, then that conflict of interest management plan is now in full force. So in terms of areas in which we are concerned about, we actually look into actual conflicts of interest, apparent conflicts of interest, perceived conflicts of interest, and also potential conflicts of interest. We take actions for all these. We also look at financial and non-financial conflicts of interest, but we also look into conflicts of commitment. So our policies tackle both conflicts of interest and conflicts of commitment. So what are some of the challenges related to handling of conflicts of interest and conflicts of commitment within our university? As I deal with investigators, I see conflicts of interest being seen as something that we need to avoid. So people don't feel free discussing these issues, even with me. There is lots of secrecy on conflicts of interest declarations and management. And yet, when we actually identify one, the policies require that we make this public. Anyone who comes and requests for information about conflicts of interest, we don't even check on who it is, we actually provide that information. So this actually emphasizes on the transparency that is required. So initially, as I've been working with investigators, lots of them have not been comfortable in discussing these issues, but now over the past few years, I now see lots of them actually being upfront with me and coming and disclosing openly their issues. But as a university, we also have a challenge of disjointed efforts, which are burdensome to the PIs. There are various tools that we use for reporting. So right now we're trying to come up with a unified system so that the PIs use a single system, and then for us, the administrators, we use that same system for reviewing the conflicts of interest. So at the end of it all, I want to emphasize that conflicts of interest are more frequent in research-intensive institutions. I know that lots of universities across sub-Saharan Africa are trying to grow their research. And as research grows, then more conflicts of interest will be disclosed. But I think more importantly, what we need to do is to change our attitudes so that those who declare conflicts of interest are actually viewed as the stars and not actually as the trouble makers. We also need to make conflicts of interest oversight environment friendlier to the investigators and also even to the institutional leadership. I want to emphasize that a perceived conflict is as potentially damaging as a real conflict. So we actually need to tackle everything from perceived to actual. And at the end of it all, also emphasize that conflicts of interest are not bad. It is how we identify and manage them. So I hope that from these few slides, there are things that we can talk about later on. So thank you very much for giving me this time. Thank you.
Thanks so much, Professor Ndebele. That was very clear, and I'm sure there'll be lots of questions. And I think your last point that, you know, conflict of interest is almost inevitable in different situations. It's not the conflict of interest that's the problem, it's how we handle it. And if we mishandle it, that's the problem. So the idea of handling it better is key. Are there any questions of clarity anybody wants to raise? Okay, if not at this point.
Sorry, I do. Excuse me. I have a question.
We will move on. So I'm very pleased then to. Sorry, I didn't go ahead. Is it Ava?
Yes,
Ava.
thank you. Thank you, and thank you, Paul, for that wonderful presentation. I wasn't sure what a conflict of commitment meant.
So basically, when we're looking at conflicts of commitment, there are lots of situations that bring about conflicts of commitment. For example, if someone is engaged in lots of different projects, it actually means that they are not giving adequate attention. But let's also consider someone who is working for our own institution, but is also working for another institution. So they're actually being paid by our own institution, and yet they are using our university time to work for another institution. So there are lots of situations that bring about conflicts of commitment. If we're looking at grants, I might actually receive some funds from an SGC, and then I use these funds for other tasks. So that's actually another, conflict of, commitment. So there are lots and lots of examples that I can give. Thank you.
Thank you.
Abram? Thanks, Ava. I apologize. I've now got my participant list on. I can see hands, and I can see another hand from Abram. Abram Opare.
No, that was my question.
Go ahead, Abram.
Okay, so my question borders on the fact that I think so far the presentations that we've had, it has touched more on financial conflict of interest, and you've shared how it is managed in the various institutions. But we also know that you can have conflicts of interest that are not financially related, maybe for career advancement. So let's say, for example, pushing a narrative on how vaccines are in a certain way. And then as a researcher, I go ahead to do a research that is investigating that area. There's that potential for me to be biased in that aspect. I don't know if you can share your opinion on how usually you manage conflicts of interest that are not financially related, but are due to other factors like career advancement.
Yeah, thank you very much for that question. So as I was actually preparing, I had actually included, some 3 slides, one with financial conflicts of interest and another one with the typical non-financial interests. So on that particular slide, I'd actually included relationships and friendships, right? For example, in our situation, we've got lots of investigators that work with their spouses as teams. And over the past, 2 years, I've actually assisted in designing some conflict of interest management plans to address those situations. In our university, we also have a nepotism policy, which does not allow people that are related to be reporting to each other. So now when it comes to conflict of interest management plans, we are also even factoring the nepotism policy in there. So when we're looking at a situation such as that one, where we are looking at, let's say, spouses that are working together, we want to ensure that we also bring in another person or other persons who are not part of that marital relationship, so that they are working with that particular team. There are also other interests, for example, that include even personal beliefs. It could be religious or political affiliation, right? In so many situations across Africa, you know that Professor so-and-so belongs to this particular political party. And when you see and when you read their papers, they're actually so much biased in favor of that particular political party. So when you are looking at those situations, what we are saying is, what are some of the measures that you can put in place to ensure that the findings that are going to come from Professor so-and-so are going to be objective? So these are the various strategies that we are actually putting in place to ensure that at all the different points, there are some measures, for example, the inclusion of others. For example, we might actually require that the data be reviewed by someone, the findings be reviewed by someone before publishing. Thank you.
Thanks, Paul. Thanks, Abram, and thanks, Ava, for the questions. I think we're going to move on and then have a bit of a consolidated discussion. So I'd like to invite Dr. Michael Makanga, who is the Director of the European Developing Countries Clinical Trials Program, the EDCTP, which many people will know. He has lots of experience working on health and poverty-related infectious diseases in sub-Saharan Africa. He's a medical doctor qualified from Makerere, has a PhD from the Liverpool School of Tropical Medicine. He's also a fellow of the Royal College of Physicians in the UK, and he served in various scientific and policy advisory boards for philanthropic organizations, product development, World Bank, pharmaceutical companies, etc. So he's very experienced, and he has recently published some work on health research governance. So we're very pleased that he's been able to join us. So I'm hoping you are able to share some thoughts about this very important topic. Over to you, Dr. Makanga.
Thank you very much, Professor London. And first, I would like to thank all the organizers of this meeting and all the participants to this meeting. On the side of the European and Developing Countries Clinical Trials Partnership, the subject of conflict of interest is very, very important, and we take it very seriously. As a funding organization, we always ensure that we adhere to the highest ethical and scientific standards in all the work that we support, and also the implementation of this work. And as I speak, our footprint globally, I may share my screen briefly. Yes, sorry, allow me to share my screen. Will you permit me to?
Simpire, are we able to sort out share screen for?
Okay.
Simpire, yeah.
I'll just share a few slides just to bring perspective to what I'm sharing. As I said, the subject of conflict of interest is very, very important to us. And as you can see, I'll share just a few slides so that I leave enough time for discussion. As you realize, we have activities in 41 African countries, and this involves working with research institutions, institutions of higher learning, with governments, with national ethics committees, and also with institutional committees. But at the same time, we support highly collaborative research that is spanning across diseases, ranging from malaria, TB, HIV, neglected infectious diseases on the priority list of WHO, and diseases that are epidemic potential as well. And we do this in a very integrated way by also supporting the capacity to be able to do this. And I'll speak to this. But before I leave the work that we support, giving you the global picture, what is fundamental is that before we fund this research, as an organization, charity begins at home. we have to comply with regulations that adhere to serious combating conflict of interest. And in this, we have very comprehensive procedures for managing conflict of interest internally. And as you know, in order to release public funds, this has to be done in a transparent and fair way. And in this case, we use a peer-reviewed approach. And all the individuals that are involved in the peer review have to declare their conflict of interest from the scientific front, financial, their membership in terms of any bodies or equivalent that they are serving in, and they also any advisory functions that they have, any occasional consultancies, memberships or affiliations, and even family affiliations. So all these are taken into account before we engage them. Additionally, we also publish the names of all our reviewers, not specific to an activity, but globally every year. We publish them on our website so that all people know the individuals that are involved in the review of activities. Now, of the work that we support, much of our work is on research and development, and this involves clinical development of medical interventions. And as you can see, of the 41 countries, 37 of these countries are actually involved in the enrollment of research participants as volunteers in case of vaccines that may be health individuals, or as patients in case of therapeutic interventions. So all this has to be done in a very transparent manner. Going beyond the usual diseases, we've also invested in responding to disease outbreaks. And I'm giving this example of COVID-19, some of our ongoing activities. Now, managing conflict of interest in situations of emergency is different. Here you have to act in a very timely manner. You are dealing with individuals that are working on the same areas. How do you manage, even in the situation of peer review? This is where digital technology had to come into play to bring in resource persons from all over the world, irrespective of distance, to be able to do this quickly, but in a more transparent manner. Now, how do we go ahead in a balanced way to support management of conflict of interest for health research in Africa? I would say that our approach is threefold. One, in providing training or support for training for individuals. So we have different approaches of supporting people, long-term and short-term training activities, where we develop the local capacity in countries to be able to determine their own research agenda, although in a collaborative way. And we have a very comprehensive fellowship program, processes where we are supporting development of rigorous and efficient ethical and regulatory review, and also supporting the physical infrastructure. And I will a little bit more about that. I would say that our footprint in Africa in supporting ethics and regulatory activities is currently supporting 37 sub-Saharan African countries. But what are the areas that are important here? Development of solid standard operating procedures and having processes that are transparent and comparable and adjusted to the good clinical practice. The strengthening of institutional committees, having people that are competent and independent to do this work. And more important, encouraging institutions to set up offices of research integrity and compliance. On the global scene, we've been part of an EC-funded initiative to support the development of key ethics tools like the global development of the Global Code of Conduct for Fair Research for Contracting, Web tool, and also we contributed to the SAN Code of Ethics. Again, globally, we've set up the Knowledge Hub, and this is in collaboration with the Global Health Network. And this is to equip local investigators in the development of protocols, data management, and data sharing. These are areas that are helping individuals in low and middle income countries become independent and also more rational towards the research that they're involved in. Allow me also to state that most of these resources are available on our website. You can access them. And in particular, I refer you to the portfolio for clinical research capacity, which really spells out most of this work in detail. I'll not go much into that in detail here, but at least.
Mama.
Could I ask non-speakers to just mute your microphones, please? Simpiwe, you've muted Dr. Makanga.
Okay, sorry, I had been muted centrally. I was saying that in the interest of time, I encourage you to visit our website and the resource on the capacity, clinical research capacity that summarizes our work in these areas. And in conclusion, I just want to end with 3 main observations. One, in our experience in sub-Saharan Africa, it is very important that institutions establish research integrity and compliance offices. It is lacking, this is lacking in many institutions. Secondly, we all need to periodically review our current practices. We need to review our systems and processes so that these are improved upon, and often this requires an external eye. In our case as an organization, in addition to having external reviewers or auditors, we also have independent observers in our review processes. They come and sit in to really ensure that the processes are going on in a transparent way and their reports are publicly made available on our website. The second observation is that we need, rather third, we need to draw lessons from the recent and current epidemic situations, because this is changing very much the way that we work globally. And this is more so with the growing use of digital technology, which has different requirements in the management of conflict of interest, especially when you need resource persons to be involved. And with these few words, I'll hand over to the chair. Thank you very much.
Thank you so much, Dr. Makanga. That was really interesting, and I'm sure there are going to be lots of questions. And I think you also emphasized the importance of systems there. So are there comments or questions people want to make? We're going to open it up actually for all the presentations. So if you have questions of clarity or questions you want to raise or comments, now's the time to make them. I think I'm going to kick off then if nobody's going to jump in. I'll jump in. Particularly the George Washington experience, but even to some extent the EDCTP is possible because of the availability of resources. And I'm wondering what we can do, because in a sense, you know, what Professor Ndebele was describing was kind of a Rolls Royce of managing conflict of interest. You have like all the options. And in my understanding, that's possible because the institutions resource their ethics function quite well. And they resource it well because they're able to extract quite high overheads from research grants. As we know in Africa, institutions that get research grants extract very low levels of overhead. And so can't really build the institutional infrastructure to do what George Washington is doing. I don't know if any of the speakers want to comment on that issue. So how, if we are going to build offices of research integrity, can we do that if we're still getting 7% on our NIH grants, for example? Because that is how we're going to have to build those offices. Does anybody want to comment on that?
Well, I'll make a quick comment here. Our approach to this has been using a two-pronged approach. One is that we have dedicated grants that go towards ethics-related activities, that is for development of the infrastructure and people development. And then we have dedicated grants that go towards research and development. We had done this also to be able to manage conflict of interest between research and ethics, regulatory activities. Additionally, on the side of overheads, we realized that when it comes to institutions, this money is needed for functions like setting up of ethics, this kind of offices. And in that case, our overheads are actually sitting at 20%, not 7%.
Good for you. What can I say? Good for you.
Yes.
Paul,
So in addition to what Michael said about those capacity building grants, the NIH is also offering G11 grants that are also aimed at building capacities for research integrity and research ethics.
Yeah, no, I'm really thrilled to hear that, because this has been a,
Yeah, can I go on?
Not sure about that. Go ahead, Paul.
Yeah, so the NIH has also been making available resources through the G11 mechanism. And I'm actually, part of a grant in the Democratic Republic of Congo, which is aimed at developing the oversight structures at the University of Kinshasa. So you can always, gang up with, your collaborators and apply for such mechanisms. But I also want to say that you can start small. To start an integrity office, you can just start off with just one person who has been trained. There are lots of programs that are currently training individuals in sub-Saharan Africa. So you can start off small by just having one person, and with time, as you grow resources, then that unit can now grow into a bigger one. Even as GW, we are not yet there, but we are still in the process of growth, so that we get to a level where we actually satisfied by what we are doing.
Thanks so much, Paul. I think Commentary wants to comment. Commentary Moodley is head of bioethics at Stellenbosch and part of the team. Commentary, over to you.
Thank you, Leslie, and thank you to all the speakers for wonderful talks today. I just wanted to agree with Paul that to establish a research integrity office is a low budget item to start with. And as he says, even if you had somebody working half a day in that office, it would be sufficient to get the process started. For many of the grants, NIH is limited to 8% in indirect costs, but other funders provide much more, ranging from anything up to 25% of grants for grant funding for indirect costs. So I think we need to ensure and negotiate with our institutions in terms of how the funding for indirect costs is going to be used. Thank you, Leslie.
Thanks, Commentary. Are there any other comments? I wanted to speak to just reflect on the sense of whether researchers actually understand what a conflict of interest is, because a lot of our systems rely on the fact that researchers will identify. And I mean, Paul, perhaps you want to comment from your experience. Do you think researchers really know what a conflict of interest is, and how important is that?
Thanks, Leslie, for that very interesting question. So for us, we do lots of training for our investigators on conflicts of interest. Mind you, I mentioned earlier on that our investigators are required to take this online training, but we also offer, face-to-face or, the online training for them. Additionally, also for our doctoral students, we want to ensure that all of them have actually gone through some sessions on conflicts of interest. So when I'm dealing with investigators, through my initial conversations, I actually realized that there is lots of misunderstanding. But with time, as I spend time with them, and then I explain to them how I am looking at things from my own standpoint as an official, then they end up understanding how we look at issues of conflicts of interest. So in a typical training, I would say I need something like 2 hours just to explain the basics and also have case studies where I'm taking them through these, and then afterwards, you then see they are asking lots of questions, which simply show that we still need to do lots more, even within our own setting. So I'd also encourage colleagues in different institutions to ensure that they bring COI training into their own institutions and specifically include, case studies.
Thanks so much. I don't know if Dr. Makanga or Dr. Agboola want to make any comments at this stage.
Yes, I'll make some 3 quick comments in this regard. In our experience, we have, and we are dealing with 3 types of research. We have academic research, and then product development related research. And for lack of a better word, I'll bring in another category, and that is research that is linked to epidemics or emergencies. Because the management of interest here is very different. Most of the academic research may involve relatively small budgets. And these may be very well managed and regulated in a sense. And the main interest might be on making sure that data is generated and this is published. And usually the interests tend to be more scientific. And then you have the product development related research. And we do a lot of this too, where we are pairing up academic institutions with pharmaceutical companies and other product development partners. And often large budgets are involved here. And these are products that are to be progressed, to be made available to the people that need them most. And in this case, really the health research interest and the health interest of the people are very important, especially when you're dealing with neglected communities or poor communities. So in this situation, community engagement and also getting the views of the local policymakers and people that are involved in determining the local scientific agenda is key. The last category is the category of epidemics. And in this case, it's the situation of speed. And at times you also have the pressure that is coming from the governments that things have to happen quickly. So there are different levels of interest here that have to be managed. Over.
Thanks so much. Very interesting points there. Dr. Agboola?
Yes, Leslie. I think I would like to say 2 things in relation to this broad discussion about knowledge, understanding capacity at country level, particularly here in Africa. One is individual researchers, it will be mixed, those who actually have understanding and those who may not. But I think the key part is, do the regulatory systems appreciate what conflict of interest actually is? Because that's the, I don't want to call it the police, but that's the motivation for the individual researchers to either follow a good path or not. And for example, for us, now that we are expanding clinical trial sites on the continent, this is a very, very important part of our requirement for inclusion of a site in any country, that there must be a very clear regulatory authority whose track record is include conflict of interest, because this is an area that is very, right now, a lot of attention and money pressure, etc. So that is one of the criteria that we require as before we can be able to adopt any clinical trial site on the continent to be part of our network. So that regulatory authority for me is the biggest one, because then it provides the right motivation for the individual researchers to be able to follow the path of avoiding conflict of interest of whichever nature, whether it is tangible or the more intangible ones. Thanks.
Thanks so much for those comments. Kimentri, you have your hand up. I don't know if that's a legacy hand.
Sorry, Leslie, it's an old hand.
Legacy hand, okay. Dr. Moeti, Temba.
Well, thanks very much, Leslie, and many thanks to all the presenters, for the panelists, for the great presentations. Dr. Makanga touched on the issue of, the relevance or importance of research, local research agendas. And I think in a developing country context, that's often a very important thing to think about. And it's great that we've got Dr. Makanga here from a funding organization. Now, it doesn't necessarily fall into conflict of interest to say, but to what extent, as part of this process and in part of our development of research capacity going forward, does he see the importance of, for want of a better word, managing funder influence or ensuring funder sensitivity to local or country research development agendas, because quite often these may be different to what's happening to the priorities at the institutional level. And if you're going to develop capacity in countries, I think this is a relevant starting point, even though you don't want it to stifle or impede the kind of research that is being done at institutional level. Thank you.
So who would like to kick off a response to that?
Okay, I'll respond to this, and with this, I'll categorize my response in three. One is the immediate, the intermediate, and the long term. In terms of the immediate, on our side, we use two approaches to ensure that we have adherence to or recognition of the local needs of the countries where the research is actually taking place. We use a push and pull approach, where first we get the research priorities as defined by the countries. And this is from the national research documents or documentation, and also involvement of the researchers themselves from the low and middle income countries in our case. The pull mechanism is where we also liaise with WHO. As you know, WHO has these global disease programs where they have looked globally and defined research gaps based on existing policies, in which case they identify research gaps and they say that these are areas that require attention. So that is the immediate. The medium term is where now we are investing in training of the local research capacity through developing of the expertise. So we have a very comprehensive fellowship system. And I can speak to this, that we've seen this work, that the people that have been developed as local researchers when it came to the COVID-19, they are the people that are serving in the national advisory committees. They are the ones that are advising the government on what should be done in countries. That is the medium term. And the long term, of course, is at the national level, where the governments really have to take ownership and say that we need to invest in research. And moving forward, we need to put money in these areas. Over.
Okay, thanks very much, Dr. Makanga. I think we're probably going to have to wrap up this discussion. I think it's been very fruitful. We've had a lot of important ideas floated, particularly the importance of systems and the importance of starting where you can, and ideas about setting up offices or mechanisms to deal with ethics, improving ethics and integrity. And within that, conflict of interest could be dealt with. We've had some good examples from other settings, and we have ideas for going forward. I want to thank all the panelists, including Dr. Marco Barlow, who wasn't able to join us, for a very stimulating discussion. And we're going to spend the last half an hour or so of this meeting just reflecting on the nature of the project. And I'll ask you just to bear with me while I screen share again, so that Dr. Saban and I can just explain a little more about what we're planning to do. Can I just confirm you're able to see my screen? Correct? Anybody?
Yes.
I hope you can hear me.
Yes.
You can see my screen. Thank you.
Yes.
So various people have presented, thanks so much. Various people have presented definitions of conflict of interest, and essentially we're all agreeing with this idea that it's where there's a set of conditions where there's a primary interest and a secondary interest at play, and it could result in negative impacts on integrity and objectivity of research. And we've heard some discussion about particularly commercial interests being at odds with public health goals, but we've also heard about the idea of state pressure sometimes compromising independence. So if we think about all the parties, and probably this list is not complete, there are many entities at play, and this project is really focusing on those entities where decisions can be made. In other words, the sort of gatekeepers, the research institutions which will have ethics committees, the science councils, and to some extent funders, because science councils are funders who have to make decisions about what to fund and whether conflict of interest is a problem for what they fund. We haven't really discussed why it's so important now, and I think the elephant in the room in a way is dwindling research funding for some areas, not all areas, but some areas. And so you are often faced with the lack of funding to do research and the growth of public-private partnerships and offers of private funding, which are very difficult to resist, especially in low middle income countries where research funding is quite scarce. So I want to share just three quick examples from my context in South Africa. So in South Africa, alcohol is a major health problem. It's responsible for 7% of deaths. The South African government aimed to regulate advertising hours and access, but every legislative move by government is met with mobilization of what are small traders of alcohol, people vending in communities. There was a report submitted by the Sustainable Livelihoods Foundation, whose research was submitted to Parliament to argue that the legislation would destroy informal sector livelihood. But the foundation is funded by the South African breweries, funded by the alcohol industry. And there was no actual declaration of industry funding, even when the paper was published in the peer-reviewed journal. Dr. Marco Barlow mentioned the sugar tax in South Africa. We, based upon international evidence, proposed a 20% tax on sugar-sweetened beverages. There was intense public debate, lots of negative press, very heavy lobbying. And the Institute for Race Relations, of all things, brought out a research report called a stealth tax, not a health tax, to oppose the tax. And they engaged Treasury to try to drop the tax. And it subsequently emerged that Coca-Cola had funded the study. And we know now that the sugar tax was finally adopted at a rate of 10%. So that was a clear effort by industry to try and influence a policy decision based upon evidence. And more recently, with the first wave of COVID, South African government banned the sale of tobacco products on the basis of evidence that it was increased risk for severe COVID. There were two industry challenges. One was lost and one was won. The evidence mustered by industry for the court case was dominated by preprints. In other words, they hadn't been published in peer review, and also by researchers who didn't declare their industry funding. So it matters whether there is conflict of interest in research and how it's managed. So what we are doing in this project is essentially focusing on three elements. We're doing a capacity and needs assessment. We're going to develop an online course, open access, and we're going to develop a toolkit for institutions. for the research ethics committees and science councils. And this seminar is really hoping to kickstart that process so that we can get as much cooperation across sub-Saharan Africa as possible. I'm going to hand over now to Dr. Saban, who's the senior researcher on the project, and she's just going to share briefly where we are with the research, and we can then have some discussion. Amina, are you able to share?
Okay. Can everybody see that?
Yes, it's quite clear.
Okay. So good afternoon, everybody, and thanks very much for the opportunity to share the essentially what the process of doing our project is currently entails. Just to start off with, we have had approval from our Human Research Ethics Committee at the University of Cape Town, as well as from all the other participating institutions involved in the study. And the study methods generally, the general study design has got two components, as Leslie mentioned, in that we first have what we call a situation analysis, which is essentially the research component of the analysis. And then the second component of the study is where we are going to apply the findings from the situation analysis in order for us to develop the toolkit and online course that Leslie has mentioned. And these instruments are going to be developed in order for us to address and manage conflicts of interest and assist other institutions to do similar. And for the purposes of our project, the emphasis is on the application of the situation analysis to a toolkit and online course for use in research ethics committees and science granting councils, particularly pertaining to health research. The instruments that we're using for the situation analysis are going to, or are iterative in that we are using the 3 instruments that we have developed for the study to where the first step is going to inform the questions that we are going to use for the second step, and then the second step is going to inform the questions we are going to be using in interviews in the third step. So the 3 steps are initially what we call a pilot, which is a brief set of interviews that are going to lead into an online survey that we're going to be conducting. And then we're going to select some representatives from institutions with whom to conduct in-depth interviews, but I'll come to that later. The unit of sample, for the sake of a better term, is essentially the research ethics committees and science granting councils in sub-Saharan African countries. And we have selected countries on the basis of the World Bank income level definitions of lower middle and upper middle income countries. And we've selected 3 lower income countries, 5 lower middle income countries, and 2 upper middle income countries. And we estimate that we will be interviewing representatives from 30 to 40 research ethics committees and science granting councils in sub-Saharan Africa. And this is just a summary of the instruments that we're using: the interview guide initially, an online survey subsequently, and then finally in-depth interviews with selected individuals. And the process is going to entail our identifying the research ethics committees and science granting councils in the selected countries that we have, using our academic networks, social and networks, and the available lists that are available online. We will then identify senior representatives at these institutions, obtain informed consent from them to conduct interviews. And then when we conduct the interviews will be conducted virtually or by telephone, depending on circumstances. And then, as I said, subsequent to that, we will do in-depth interviews with 6 individuals from selected institutions. The data collection for the study is all going to be done via the interviews, and the interviews will be on a platform such as Zoom, and all the interviews will be recorded and transcribed, and then the transcribed data will be analyzed qualitatively using both coding and subsequently thematic extraction. And to date, we have completed 3 pilot interviews that have been conducted with 2 science granting councils and 1 research ethics committee. All those interviews have been transcribed and are currently being coded for further analysis to inform the online survey questions. And the findings generally have been with what is obviously a very small number of people that we've conducted interviews with, but we found that generally the organizations that we've interviewed have expressed familiarity with research principles and the need for scientific rigor and for maintaining high standards of research. And they recognize the need for ethical conduct while doing the research. For example, they are able to identify when there are gaps in the protocol review process, and they have admitted that certain protocols do slip through, and often they have principles in place to guide the high standards of research that they require, but there is a lack of adherence to these principles, and they often lack the capacity to address the non-adherence to the research principles that they aspire to. They, for example, we've found that they require declaration of conflicts of interest, but they often lack the mechanisms to identify and to address the non-declaration of conflicts of interest. So there are identified gaps in the policy implementation, even when policies do exist. And there has been, we have elicited information that there are some policies that maybe require additional input, and maybe there are some policies that need to be developed. And one thing that came up was that the institutions themselves, the science granting councils and the research ethics committees, often find themselves under pressure from politicians to circumvent some of their own regulations. And the interviews we conducted also highlighted that there are often unequal research partnerships that exist, including the ones with political interference, where you have political parties, for example, exerting pressure on the institutions and holding researchers and institutions to ransom to some extent by threatening various aspects of their work. So general experiences that I've had primarily have been that there are lists of contacts that exist, both online and via our academic networks. And our colleagues have been very helpful in providing us with contact details for eligible participants in our study. But unfortunately, we also find that when research in institutions like science granting councils and research ethics committees have websites, you often find that the websites are outdated, or they're unpopulated, or they even mention the fact that the information that is available on their websites, that the information is that needs to be updated. We've also found that when we've made contact with members from institutions in sub-Saharan Africa, we give all the information about our study, but we often find that there's a misinterpretation of our study plans. And one of the particular misinterpretations have been that when we request to have an interview with a senior representative of an institution, we are requested to submit a protocol, and we are expected to apply for approval from the research ethics committee of that particular institution, when all we're wanting to do is to interview a representative of the institution. So that misinterpretation often causes a huge delay in our being able to either make the contact, and also subsequently to a delay in being able to conduct an interview. We also find that where contact details exist, like for example, we have telephone numbers for either the institution, and sometimes we even have telephone numbers that are supposed to go to offices of individuals, but we find that the telephone calls are rarely answered, which means that those are also interviews that don't get conducted. We also find that from the available contact details, telephone numbers and email addresses that we are provided with are often invalid. And one of the major problems that we experience is that when we are encouraged by being able to identify a particular individual in an institution with all the contact details in place, we find that the individuals don't respond to our emails and to our request to conduct an interview for our study. So in conclusion, we are anticipating that the webinar that we're having today will improve the whole process of obtaining successful interviews that can be conducted, that our contacts via this webinar will be able to assist us in facilitating successful contacts with potential interviewees and result in conducted and completed interviews. We also hope that we'll have a continued relationship where we might be able to engage with people on this webinar in future collaborations. And lastly, we would like to appeal to all the webinar attendees in the countries selected for our interviews to kindly inform research ethics committees and science granting councils and their representatives in your countries of our studies, so that when they are contacted by us, that they would be informed with the information that we provide, that there will be no misinterpretation of the information that we provide, and they would kindly try and cooperate with our study needs. Thank you.
Okay, thanks, Amina. So I think we've presented the project and the research, and we just open for any discussion if anyone wants to make any comments or ask any questions. So I think the process of developing the tool and the course will happen in parallel as soon as we can. I see Inam, you have a comment. Over to you. Inam?
Yeah, thank you very much. And thanks very much for all the presenters for a wonderful presentation. Now my question is maybe to Amina or perhaps the others. Well, Amina, I'm not sure that called interviewed me or approached me, but anyway, I guess I would say she interviewed me. And then I was informed of this webinar. But I really am not sure what next. Was I invited just to attend, listen, or I have no idea. So please, can someone explain whether there's anything expected from some of us who were interviewed and who have been invited to attend this webinar. Thank you.
So Amina might want to fill in, but essentially this is an open webinar and it's targeting all science councils and ethics committees in Africa with the idea that these institutions will be the beneficiaries of what we produce. And for us to produce something useful, we've gone and asked you what would be useful. So there's no expectation of you, particularly after this webinar, other than to maybe make use of the products that come to you that should be useful. Amina, I don't know if you want to add to that.
Yes, Inam, thanks very much. Yes, for availing yourself for an interview. The information that you provided was particularly useful, and that will inform the instruments that we subsequently develop, as Leslie said. And then once the instruments that we develop, both the toolkit and the online e-learning course have been developed, we will be able to make those instruments available to all institutions, including the one that you're attached to at the University of Zimbabwe. Thanks.
Okay, thank you very much.
Thank you. And there was a comment in the chat. I'll just point it out. Tiwo Mpande made the point that it's interesting that researchers or RSCs don't want to be researched. I'm a researcher, but I know I get asked for research to participate in research, and I might not necessarily want to do that. So everybody has their choice. But we're hoping that this webinar will encourage uptake of the project, so long as people understand that it is of benefit, and hopefully that will be the case. Are there any other comments or points people want to share? So if not, then I'm going to suggest we close. It's been a long session. I'm going to just put up a page with just some resources, which you might find useful. I think what was mentioned was the, oops. My apologies. What was mentioned was the WHO policy, which Dr. Macabalo referred to, and you'll find it at that WHO website. We are part of a global network on conflict of interest and in public health, and you'll find it at the American University of Beirut website up there. And I've listed 2 publications that have stemmed from that, looking at conflict of interest, which you might find helpful. And I've put Amina's address into the slide if you need more information, and I will post this in the chat. But if there are no further comments, I'm going to thank everyone for participating. Thank our speakers who've made some excellent presentations, really helpful, really stimulating, and taken of their time. I want to thank all the participants who've been very engaged with the material, and we felt it was really useful. I also want to really thank my colleagues on the team, because this was a team effort, and we put this webinar together as a team, and it really, their contributions and identification of speakers really played an important role. And of course, last but not least, I must thank our funders, the IDRC, who've been willing to support the project during times of COVID when it's been hard to make progress, but have been flexible enough to accommodate the delays. And particularly thank them for being able to see the importance of this work going forward. Okay, so I will post this material that I've posted in the screen in the chat, and if you do want to copy it, then you'll be able to just copy it from the chat before we close. Otherwise, we're going to bring the meeting to a close, and thank everyone for participating. Thank you so much.